Welcome to this edition of CTSB TV's interview show. I'm your host, Mitch Kruszyna, and with me today is Kruszyna, who is a member of the nursing staff at Baystate Medical Center. Welcome, Crystal.
Hi, thanks for having me.
Crystal is my sister-in-law. I'm glad to have you on the show today. To where to begin? Could you tell us more about your position at Baystate?
I am a frontline healthcare worker, registered nurse. I work on the team that's called the Flex team. And the Flex team is the member of nurses that we walk in the morning and they tell us where they need us and we go. So we work almost every aspect of the hospital, from the emergency department, acute care, intermediate care, ICU, pediatrics. We're everywhere.
Now, how is your average day different now that COVID-19 has hit our population, and how different is your day now compared to the way it was before?
Now we still walk in and we go to our office to find out where they want us, but we're pretty confident we know where we're going to go. Our team has been assigned to the initial admitting COVID unit at Baystate for the sicker of the sick, the ICU and intercare level patients. It's recently been transitioned to just the ICU level patients. And we have developed a team approach nursing to help take care of these patients. We realize we can't do the one-on-one nursing. That would be the ideal perfect world if we could create staff. Mm-hmm. So we've created a team approach. An ICU nurse will be teamed up with an intermediate care nurse and possibly an acute care nurse so that we can share what we're doing with more patients than would normally be expected of us. So those of us that are not ICU nurses are learning and up-training very quickly on how to be more efficient and help take care of these patients and give them the best care that they can get. And hopefully we continue to have the successes that we're having. So we're putting on a lot of miles. Yesterday, I put over 4 miles on one unit when I counted my steps at the end of the day. That's quite a bit. We're helping support each other. We're making sure that we're taking care of each other, which is the best that we can do in order to provide the best care for the patients. We're learning how to reach out to families in a different fashion because we no longer have the ability to talk to them at the bedside to help keep everybody safe, us, the population, the public, and family members of these sick patients as well. So we're just learning all kinds of skills and bringing in everything we can. Mm-hmm. Anything that starts working in one area, we quickly move it to another area to expand on that positivity.
What is some of the gear you have to wear to protect yourself and from contamination and things?
I'm sure you've heard it all over the news, the PPE, personal protective equipment. We have N95 masks that have to be worn anytime you're in a room with a patient, and anybody wearing the N95s must be fitted to have the right mask that does the right job for you. Everybody's face is slightly shaped different. What works for me might not work for you. So we have an array of different masks and everybody is given and fitted with the right mask. We also have to wear eye protections. So we're protecting all our mucous membranes, our eyes, our nose, our mouth. We wear shields or goggle glasses. We prefer the shields. They offer a greater wide range of protection. We wear gowns, either disposable or gowns that can be cleaned and used again, which is something we've just recently brought in. We wear gloves, and we're also wearing hair protections just to keep all of this contained to reduce the risk of carrying it out of the room into a safe area where you could have lunch or even home to your families. So that's what we're doing right now. We're struggling, we're making sure we have what we need. We're trying to be very mindful of how much of it we use. Sometimes you would opt to keep your mask on for another hour rather than stopping to get a drink that you probably should have, so you don't have to need another mask. So we're making choices on what we feel is the best way to take care of our patients and each other.
Mm-hmm. Now, supplies, are you finding them in short supply, or are you finding that you're making do? with equipment and with gowns and masks? And are you finding there's short supply or?
So far, we've had waxing and waning in our supplies. And we've had to change some of how we're using them based on what we have so that we don't run out.
Mhm.
We've never been told we're out of anything, which is great. I believe our organization is doing a good job keeping us informed on when we're getting low so that we can be even more mindful than we already are and how we're using them.
Mhm.
Sometimes, unfortunately, we do sacrifice ourselves, meaning we would keep that mask on for the 4 hours we can and not go to the bathroom when we might want to, or get that drink when we might want to, because that would mean we would need another mask that we might not have or somebody else might not have because we chose to have a drink. So we are a little bit sacrificing, but so far we've not run out of anything, and we did see an influx in some of our supplies recently, which is nice, makes us feel a little better as staff workers.
So when did Baystate become aware that this was going to be huge, huge event, the pandemic in our area? And did they prepare in advance for it, or was it kind of like something that you were kind of caught off guard, not expecting, or were they well prepared in advance?
Well, everybody was, watching it develop as it spread from country to country, and then eventually we did find our first case here in our country, and then and there was, I'm sure, lots going on behind the scenes that me as a frontline worker were unaware of to prepare and think about what it would look like when it came to our hospital, when it came to our area. We had waves of changes that came as the patients started coming, as the need for testing approached our area. As we saw patients that had symptoms that could be COVID, we developed a team that took care of the people that we were first testing. We called them rule-outs. We were testing, and at that time we had a 4-day turnaround on testing. So we were taking care of these patients as if they were positive for this virus. Once we found out they were or weren't, then we determined where the appropriate place for them would be. So we had waves of changes that came about as the virus became more severe and more inundated in our area. So they've been working. There's already, another wave after the wave we're currently in planned should it become necessary to advance what we're doing and take in more patients than we have now. We also have a little bit going on. What is it going to look like when we go back to normalcy? Which we're not sure what that's going to look like, but we're thinking about that also. What's going to happen when we can say that we are back at our baseline? Is it going to be a new baseline? Are we back to the way we were? Are we always going to have the worry about this virus hanging over our heads?
Has it reached a peak or a plateau yet, or do you think it's going to be in waves still, or what is your feeling on those?
Right now, we're at a very manageable number. We still have the availability to increase the number of patients that would require ventilation, intubation. We have those types of beds and setups still open and available for more people. We're managing what's in right now. Wouldn't it be wonderful is what we have this is the peak of our wave? That would be wonderful. But we're, optimistic, but we're still planning and understand that we still don't know everything about this virus. We know that the public is doing their job, and hopefully they continue to do their job to do the right thing, stay home, not conform in groups, and help keep this curve where it is and help it decline or flatten out. We're ready either way. And we're optimistic that, perhaps that the public is doing their part in making this a little more easier for the hospitals to manage right now.
Now, how is this different from the SARS epidemic that was, a few years ago? Is there any different numbers or difference in symptoms or the mortality rates and things?
Symptoms are similar. There are some differences, but the big piece from what my limited knowledge is of the SARS versus the coronavirus that we're dealing with now is that people with the coronavirus have a higher viral load before they feel their sickest. And so they can more easily spread it unaware they're doing that. And the SARS virus, from a little bit that I've researched on it as well, the viral load, the ability to spread it from person to person, tends to be higher when you're feeling not so well. So you're aware that you might be not feeling well, and you tend to keep that to yourself, if that makes sense, or stay away from people or seek medical help earlier. And we didn't see such an influx of the SARS, across nations as we are with this. This just took a wave and just kept on going from nation to nation, country to country. And we don't know what that will look like when that is considered contained or over, if there's such a word for this. Most of the cases that I'm seeing, again, I work in the positive area with the sicker of the sick. The people sought out help when their breathing was worrisome to them, bothersome to them. Their shortness of breath feeling was just uncontrollable. That's the number one symptom that forces people to seek out medical attention. The second one is high fevers. We're seeing people with extreme fevers. People are reporting having extreme fevers at home. The treatment, is we're supporting the symptoms that the virus causes. We can't actually go after the virus and get rid of it out of your body. So we're supporting you through your body's ability to try to fend off the virus. If you're a family member at home and you have somebody hospitalized that is being treated because they are positive, you should consider yourself to have been fully exposed. You should be practicing the isolation. You should be washing your hands on a regular basis. If you can, disinfect your home, doorknobs, sinks. Don't share toothpaste, anything that might spread that around, and stay to yourself and monitor yourself for a definite 2 weeks at least.
Like the malaria drugs and things, have they been helping? Have you had an experience with those medications and treatments?
We do have some patients that we're using them on. I'm sure everybody in hospitals across the country do have some patients they're using them on. The patients have to be appropriate. There are some side effects that you make sure the patient doesn't have to begin with before you would start those regimens, but it's really an infectious disease and a physician's decision to start those medications. They're not for everyone, but they might be helping some people.
Okay. Now, is the number of cases growing at Baystate, or has it been maintaining kind of leveled off?
It's different every day. We have some new people coming in. We have some people that get to go home, and then we have other people. So it's at a, I guess from what I can tell from where I work, we're kind of at a bit of a lull. Not that we're decreasing, not that we're expecting this to be it, but we're kind of at a very manageable number right now with the changes we made in care, the way that we're performing care. That's how it feels like from a bedside nurse's perspective.
Patients can't have visitors or family visitors or visitors from clergy or anything because of contamination. How do they deal with the feeling of being alone and afraid, and is there ways the attending nurses and staff help with those fears, and are most people like so sick they are not even aware, or are they aware? Kind of give us a little bit of description of patients in this situation.
We do have all levels of patients, some that seem to be managing their symptoms relatively well. We have the patients that are teetering towards relatively well and not very well. And then of course we have the patients that do require ventilation and intubation, the sicker of the sick. And we do see a lot of anxiety, like you said, feeling of isolation, missing family. Their number one support people cannot sit there and help them and hold their hands and make them feel more comfortable. We've created wonderful, wonderful teams. We have spiritual services in the hospital that are rounding on the units to see if they can offer anything anybody might need or want. We also have video chatting that we've set up with iPads, and we can bring those in and out of the rooms and, you know, clean them off so that they can be used on the next patient. Even some family members, it helps relieve their anxiety if they can at least see their family member, that they're there, we're working hard for them, that we're providing great care for them, and we're doing all we can to hope that they get back together. So we have a couple different things that we're doing. And any patient that is able has the ability to use their cell phones in the hospital, or we provide phones in the hospital so that they can at least talk to family members and just know that each other's doing okay. But in order to keep everybody safe, the public safe, the staff safe, and the patients, you know, as safe as we can, we do have a no visitor policy right now.
Well, that's understandable. And I was, you know, I'm glad that there is a video chat available, because I was thinking something like this, where our interview, people can chat together, and I'm really, it's good to know that that is available. And I think that would help the patient so much to have some visual contact with their families, and to interact. I think that's an important part of healing, and the support you get from the family.
It really is. It is. When you have, recently I've had a patient that we've been able to extubate, meaning taking the breathing tube out. He's able to talk again, you know, breathe on his own with just a little bit of oxygen support. And one of the first things we told him is that when you feel ready, we can pull this computer in so you can talk to your wife. And he just a man who could barely pick something to drink wanted to hug us all, telling us he could talk to his wife. And that was a great, great feeling for us. And to see him be so happy. And then when they finally got to talk, it was wonderful. It was wonderful. Those moments are precious.
Yeah. Wow. Now, at what point is the patient able to go home, and when is that determined by the staff?
Everybody's a little different. It's based on what you need from us supportive-wise as you're dealing with the symptoms that the virus causes, how well you are able to do things back on your own. Is your breathing status acceptable to be at home? Do you need support from us? Everybody's a little bit different. The length of time people need support is very different. There's no one line of care that takes care of everything. So it's determined by what support they have at home, how well they're doing on their own, so to speak, in the hospital, and how well they'll be able to handle what they need to do at home as well. So it's very different. But again, you really need to be able to feel comfortable and control your anxiety, and have the right kind of support at home for what you need.
Now, when the person goes home, are they no longer contagious, or are they still contagious?
Oh, they certainly are still considered contagious.
Okay.
And they do need to be educated and understand what they need to do to practicing the home quarantine, you know, so that they can just get better, not hand this off to anybody that they know, family-wise or friends. There's a lot of education going out before somebody goes home, and we do some education over the phone with whoever they'll be staying with as well.
Now, when is a person considered recovered from the virus? Are they able to use their antibodies to help other people? Like,
there is a lot, and I'm sure you see it in the news going on about that. I'm not somebody that could speak to how that is working, isn't working, or what the thought process is on that. But it is something they're definitely looking into. I mean, and we'll see if that becomes the key factor to helping people.
Anything that can help and to get over this. Do you think there's going to be a vaccine soon for the virus?
I'm hoping. You know, we have a lot of great people, a lot of great minds working on it. Different areas, different countries, they're sharing their knowledge. Let's hope that it comes soon.
Now, is there any advice you can give to our viewers on how to avoid catching the virus and, staying well?
Really, it's all the things that I'm sure everybody's already heard from the different news and reading and Facebooking with each other is, wash your hands. Don't touch your face when you're out in public. When you do need to go out, think about what you need. Group what you're doing together. Don't make stops. Try to see if you can get everything when you're in the store. Practice that social distancing. It's very, very important. And if you can, if you see somebody that happens to be coughing, clearing their throat, it's okay to step away. 6 feet is a good thing to think about. Measure that out. Get it in your head what that means to be 6 feet away right now. It's important. And if you don't need to go out, don't go out. That's the best advice we can have. Staying home is important. And washing your hands when you come in the house. Don't touch your face when you're out. You've got all these mucous membranes, your eyes, your nose, your mouth. You can just enter that. It can be on your hands and you're not aware. So wash your hands, don't touch your face. Group what you need when you go out so that you should lessen the time that you're out and exposing each other to each other, and stay home when you can.
We're kind of like restless people, and we need interaction, and we need stimulus all the time. And
We do.
But I think it's important for people to connect, and this is one of the reasons why we're doing this program series, to connect with people and to make them aware and feel like they're not alone, and there's help, and there's hope, and we're not alone, and we're in this together. And what you're doing is so important, being on the front lines and all your experience. I can't imagine, how do you, on your downtime, how do you deal with all of what you experience?
That's an interesting question. In the beginning, when it first started and we realized it was here and we were going to be in it to win it, so to speak, I found at the days I had off and the time I had home, I had a level of anxiety that I never felt before. I wanted to make sure I stayed aware of what was going on at my hospital. I wanted to make sure I'm keeping my family safe. I wanted to make sure I had everything I needed at home to help keep my family safe. And there was just, what if I missed something? But as we got in it and the plans formulated and it's working, and the unprecedented teamwork where I am is amazing on all different levels, from the physicians to the fellows to the interns to the nurses, the assistants, even the OAs, the secretaries. It's unbelievable. That's settled down, and I find if I stay a little busy on my days off doing all the things I probably put off in my home, it helps as well. So staying busy, making sure my family's doing well, trying to connect when I can on the phone, on Facebook, doing this interview with you, helps an awful lot as well. And just staying educated and up to date on what's going on.
And we're all behind you all. Thoughts and prayers are with the nurses in the front, and all the doctors, and we're hoping that we can see an end to this virus hopefully soon. Well, I'd like to thank you, Crystal, for joining us today and sharing your experiences, and we wish you well and to be safe, and hope to see you soon. And I'd like to thank our viewers for joining us. And my name is Mitch Kruszyna, and have a good day.
You too. Thanks a lot, Mitchell.
Okay.